I'm Dr. Aravindan Selvaraj. I'm the Executive Director and Chief Orthopedic Surgeon of the Kaveri Hospital, Chennai. The Kaveri Hospital, Chennai is a 200-bedded super specialty hospital. At this Chennai facility, we have established 6 centers of excellence. Firstly, the cardiac sciences. Second, the orthopedics, neuro and spine sciences. Thirdly, the uro and nephrology. Fourth is the gastroenterology. The fifth is the vascular surgery, and also the Department of Internal Medicine and Geriatric Medicine. We do get patients from all over the world for the specialized treatment that we offer here. I worked for more than 15 years as an orthopedic surgeon in London, including the world famous hospitals like Guy's and St Thomas and King's College Hospital. It gives me great satisfaction that we are able to deliver even higher level of clinical service here at our Chennai Kaveri Hospital with the better outcomes. Usually, the patients come here for the treatment for the elective problems. That means it's not an acute problem. Patients would have been having the problem for some time and they would have taken several consultations and then come here for the treatment, like for the cardiac bypass surgery or the joint replacements or the spine surgery. Recently, we got a patient from Tanzania. The lady had a fracture of the both bones of the leg, and she flew from Tanzania for the treatment of this acute fracture. That was something, a change which I have recently noticed, because the patients from elective conditions come to India for treatment. Now the patients with the acute problem also come to India. In the last month, we treated a 1.5-year-old child by name Hadi. He along with his parents came from Kenya. The child was born with clubfoot deformity of both feet. It is a congenital deformity. Baby was born with the defect. The treatment was attempted twice in Kenya. Unfortunately, the deformity was resistant to treatment. He presented to us at 1.5 years of age with resistant clubfoot. The deformity was fixed. We undertook a surgical correction of the deformity. On the operation table, we were able to achieve 100% correction of the deformity. The parents were absolutely delighted with the treatment and the outcome, and I reassured them that if the boy wants to play football for the Kenyan football team, he can definitely go ahead and do that.
This is to the viewers who are watching this clip. I would like to explain you my journey from Mombasa, Kenya all the way to Chennai in relation to my son's club feet deformity by birth. We started his treatment in Mombasa. It took us about 9 months. My son was on POP. After that, his feet were not fully normal, although the doctors did their very best to make the feet normal. My father-in-law comes to Kaveri normally for some checkups of my mother-in-law. So he met Dr. Aravindan with my son's report, and he informed me about Dr. Aravindan and the hospital. We came all the way here on 29th of January for my son's club feet surgery, and a month after the surgery, when the plasters were opened, the results were something that even I had not expected. The results were marvelous, very fantastic results, because when we came here, my son's feet were still not normal. But after the surgery was done by Dr. Nidhi Rajan, by Dr. Mukund, under the supervision of Dr. Aravindan, the feet were almost normal. Around, I'll say 98% normal. Although we come all the way from Kenya, we don't have any relatives over here. I still remember our first day, we had no relatives, no friends, only me, my wife and my son. We had so many questions in our mind that how will the hospital be, how will the environment be. But when my son was admitted over here, the first day when he was admitted at about 2 o'clock, the nurses were so nice, the doctors were so nice. They really made us feel like, we are like one family over here. They gave us good support, good morale, and we were truly impressed by the services. Apart from that, I would like to say something about Dr. Aravindan. Dr. Aravindan is the executive director of the hospital. Apart from him being a doctor, he's also a good human being by heart, because whenever I used to come for my son's checkup to Dr. Aravindan for review, he was like a good, he was treating us like a good person. He was not making us feel like, he is a doctor, that fear we should have when talking to the doctor. He was so relaxed, jolly person, someone who is flexible to talk to. We are really impressed by the qualities that Dr. Aravindan had. Not to forget about some staffs over here who really took good care about my son, about me, my wife. They were really up and down. Honestly speaking, we are very happy. We have no complaints, no regrets, and no any issues with the hospital. I will really recommend those people who are watching the videos, if you want to come for any treatment, please you Google about Kaveri Hospital. You will get the information on their website. It is a very good hospital. To clear any of your doubts, you can always email the doctors. You can communicate with the hospitals the way I did before coming to Kaveri Hospital. And the communication team, the doctors are very efficient. They will definitely communicate to you very nicely in a respectable manner, the way I have witnessed. So I would conclude by saying that you go east, you go west, but Kaveri is the best.
It is heartening to see Chennai in India emerging as a medical tourism hub of the world.